Slide വന്നില്ല madam.
Slide വന്നില്ല. അതാ try ചെയ്തോണ്ടിരിക്കുക. Open ആവുന്നു.
സമയമുണ്ട് madam.
Okay. പഴയത് download ചെയ്ത്. Agashé, okay or no? Agash, is it okay?
Madam, yes madam, it's okay madam, it's coming.
Okay, Agash, then we'll start.
Start, madam.
You give an introduction, then we'll start.
Sangeeta, are you there? Sangeeta, please start.
Ladies and gentlemen, I welcome you all to another brand new session from National College of Pharmacy. It's my pleasure for me to introduce our next speaker, Dr.
Not
Rajasree,
audible.
Professor, Department of Pharmaceutical
Akash.
Industry, College of Pharmaceutical.
Not audible, Agash. Yeah, yours is audible, but Sangeeta's is not audible. That's what I can.
Good morning, ladies and gentlemen.
Not audible, Agash.
Another brand new session from National College of Pharmacy. It's a pleasure for me to introduce our next speaker, Dr. Rajasree, Professor, Department of Pharmaceutical.
Agash, not audible.
Yes,
Am I audible?
Yeah, ma'am, you're audible, ma'am, no problem. So
Then you
okay.
introduce myself. We'll start.
Okay, ma'am. Okay. All participants, good morning. It's my pleasure to invite our next speaker, Dr. Rajasree, madam. Madam has more than 23 years of teaching experience. She had completed her PhD. 25, sorry, ma'am. And she had completed her PhD in 2020, M.Pharm Pharmaceutical Chemistry from University of Kerala in 94. She had her B.Pharm from Kerala University in 91. Currently, Madam is a Dean and Board of Studies Chairman for UG of Kerala University of Health Science. She's a very well-known personality in our state, Kerala, especially in the Department of Pharmacy. And now, recently, Madam is working as a professor, Department of Pharmaceutical Chemistry, College of Pharmaceutical Sciences, Government Medical College, Alapi. Professor Rajasree Madam has many research papers in her credit. And also, Madam is a resource person for many national and national level seminars and symposiums. She's a member of Association of Boards of Pharmacy USA, a member of APTA. Madam is also a member of, I think, Indian Society of Toxicology and also a life member of Pharmaceutical Society of Kerala. It's our immense pleasure to welcome you to this session, ma'am. Please, ma'am.
Thank you, Akash, for your nice words of introduction.
Thank you.
Very warm good evening, good morning to all participants all over India. I thank the organizers, the principal of National College of Pharmacy, Dr. Suchit Verma, Dr. Akash Maridagam, for giving me an opportunity to interact with the most efficient teachers all over India. And today, my topic is identifying drug abuse in student teaching learning perspective. Actually, this is a problem faced by the students as well as teenagers as a whole. And as teachers, we must have come across some students who are having this problem, and I have come across students who are having this problem, and you can also identify this problem in the students if you keenly watch students who are having learning problems, who are not attending classes, who are not attending practicals regularly, or who are indifferent in our classes. So we will start our discussion on identifying drug abuse in students. And my objective is to define drug addiction and drug dependence and drug abuse and types of drug dependence according to WHO, sources of abused drugs, chemistry of abused drugs, consequences of drug addiction, signs and symptoms of abuse by which a family can identify an addict, and what to do if you suspect abuse in a student. Sorry, there is some technical issues. Akash, can I hear? Can you? Okay.
Yes, ma'am. Yes, ma'am.
Okay. What is the root and how we can cure? Okay, schools and colleges are the most expected place from where individuals likely develop the drug abuse. Usually, the drug abuse never starts from home. It starts from the schools or colleges where students are having accessibility to drugs. It is the place where the teachers can do effective approaches to drug abuse prevention. In addition to the traditional education mission, our education institution often assume responsibility for addressing a variety of social and health problems. And we can define how. Let's see how we'll define drug addiction. It is a habitual. Some problems, sorry, I'm extremely sorry. It is habitual, psychological, and physiological dependence on substance or on a substance or practice which is beyond voluntary control. That is, it is psychological, physiological abuse. It is often, this drug addiction is called substance abuse, and it is beyond voluntary control. And in modern world, what is the position of addiction in modern world and how it developed? Since the 19th century, when Americans first discovered new wonder drugs like morphine, heroin, and cocaine, our society has confronted the problem of drug abuse and addiction. Actually, This morphine was the first analgesic discovered by the Americans during First World War, and it is a most wonderful drug which can be used for terminally ill person who are suffering from pain, and it is the drug most widely misused across the country. What is we can see what are the causes of drug addiction, and utilize this drug addiction usually happens out of curiosity. Students become curious what is the effect it may produce, what if we try a particular drug and see its effects. That is one of the reasons. Then friends pressure is other reason. Students may pressurize other students to try these drugs, and the excitement and adventure it produces is the reason why the students use. And to relieve from pain also, some students may try this if they are having some pain, or they may try this drugs. And to relieve anxiety and depression, they try these medicines. And out of frustration and stress also, the students may try these drugs. And what is the effect? We can see what are the effects which this substance abuse cause on friends and family. It can produce marital problems and poor performance in adults. It can produce, if a pregnant woman uses this drug because of the drug themselves, or because of poor self-care in general, bear a much higher rate of low birth weight babies than the average if the pregnant mother is a drug abuser. And what this drug, we can see what these drugs cause on teen brain and substance use. And it produces less control of emotions, worse the problem solving ability will be deteriorated, and slower processing of information take place in our brain, and lower verbal comprehension. They will be unable to comprehend things, and poorer memory can cause. And this, as we all know, teens' brain are still developing, and if these problems, if they supply drugs to the teen brain, it can cause damage permanently. It can cause damage permanently, and it can affect their future life. And this drug use can cause brain abnormality, slowed thinking, impaired learning, and memory. We can classify the drug dependence into three different categories. First, psychic dependence or emotional dependence happens, and it will not have any serious problem. It can be controlled without any drug. And the next, physical dependence occur in cases of certain drugs. Abruptly stopping that drug leads to withdrawal symptoms, and tolerance developed. You know, all of you know what is tolerance. Decreased response to the effect of drug and needs a larger dose to achieve the same effect. And what are the, let's see, what are the negative effects caused by the using of drugs. When a person is addicted to certain drugs, he got a physical and mental disorder. It produces negative effect on health. The people start hating them because they will be labeled as a group who are not liked by others in the society, and they are not respected by the others in the society, and it may produce negative effect. It may, or usually produces negative effect on education, and there are chances of them to become jobless, and chance of become criminals. And if we analyze the situation of criminals, why these students become criminals, the most important and prominent cause is drug addiction. Okay, and how the World Health, we can see how the World Health Organization classifies this dependence, and they classify into 7 major categories. First one is tobacco type, second one is alcohol type, morphine type, barbiturate type, amphetamine type, cannabis type, and cocaine type. The first 2 types, alcohol type and tobacco type, are legal. So there are chances of using it more, but the others are not legal, it is illegal, even then it is widely misused. Let's see what is the tobacco type of drug addiction. It is this tobacco is a native of South Africa. Now the tobacco plant has spread the world over. It has large, ovate, lanceolate leaves and terminal clusters of tubular white or pink flower. And the alkaloid which is present is nicotine, and that it makes it addictive and habit forming. Tobacco is legal, and we can see lots of advertisement of tobacco. It is heavily advertised. People often don't take it seriously as drug. Cigarette smoke is a complex mixture of chemicals such as carbon monoxide, hydrogen cyanide, nitrogen oxides, formaldehyde, acrolein, benzene, nicotine, and phenol. And all these mixtures are harmful to our human body, and then you can see what are the effect of nicotine. It's usually said that nicotine produces less harm to our body than other chemicals present in the smoke. But that's it. Nicotine, you all know that nicotine is a volatile alkaloid. It stimulates conduction of nerve impulses, it relaxes muscles, it releases adrenaline, increasing heart rate, increased blood pressure occurs, and increased risk of heart diseases occur, retards fetal growth in expecting mother, and it causes tobacco addiction, and even high concentration of nicotine paralyzes the nerve cells. And what are the health risks associated with smoking cigarettes? It can lead to so many diseases associated with heart disease. And those who are having myocardial infarction, when we take the history, their history, most of them must have are smokers, or they must have smoked during their lifetime. So tobacco causes cancer and heart disease. It can produce impotency in men. It produces heartburn and ulcers. Blindness can be caused by macular deteriorations. It can cause hardening of arteries and lead to atherosclerosis. And smoking reduces the proportion of HDL cholesterol to LDL cholesterol. HDL cholesterol is often called good cholesterol, and LDL bad cholesterol, and it increases the tendency of blood to clot inside the blood vessels and obstruct the blood flow, which leads to myocardial infarction. And also it because the individual who smoke becomes more prone to colds and flu, and they are frequently affected by these diseases. And second type is alcohol, and alcohol is also widely misused, and it is also legal. And this alcohol is a source of revenue. Actually, it is an important source of revenue to the government also. The tax which they collect from alcohol is an important source of revenue. And this alcohol addiction can cause series of problems, so many problems, domestic problems, violence, hostel, this stampede in hostel. All these are caused by alcohol sometimes. And why these students can or individuals consume alcohol? Social pressure. That means if somebody is not taking alcohol, they are considered as not useful, and especially among the men, they are considered not as impressive as others in the society, and they are considered as submissive to others. And most of them have a desire for excitement. That is also a cause for alcohol addiction. And if someone wants to feel independent, they may get addicted to alcohol. They develop a false sense of independence when taking alcohol. Liking of taste. Liking of taste is it's a very remote chance of taking alcohol. I suppose alcohol is not very tasty. And also a desire to escape from realities of life. Someone may have some disappointment or some reasons of, they find some reasons, disappointment due to some disasters in life or due to some failure, they depend on alcohol to solve their problem, and they feel that alcohol may help them, and for to avoid the monotony in life, they may depend on alcohol. And how much you drink. So occasional drinkers are there. Some are occasional drinkers. Some say that they will drink only once in a week. Some say that they drink daily. And how can we say that he's an alcoholic? Those at risk for different for developing alcoholism include men who have 15 or more drinks a week can be called as an alcoholic, and women who have 12 or more a week, and women are more susceptible to become addicted to alcohol than men, though women never try to consume alcohol and they are highly prone to become an addict. And anyone who has 5 or more drinks per occasion at least once a week. If weekly, if we consume 5 or more drinks per occasion, it will make them dependent to alcohol. And we know there are so many varieties of alcoholic preparations are available in our market, and beer, this malt liquor is available, wine is available, and proofs series like whiskey, gin, rum, vodka, tequila, etc. are available, and the percentage of alcohol present in these drinks differ. And this beer contains about 5% alcohol. This malt liquor contains 7%, wine 12%, and this fruit spirit preparations contains about 40% of alcohol. So the consumption can produce. We can consider all are not equal. The tendency to become dependent depends upon the percentage of alcohol present in that preparation. What are the effects which negative effect, actually negative effect which alcohol produce in our body? The health effect of alcohol abuse can include heart disease, liver disease, and even cancer. Some types of oral cancer, lung cancer, etc. can be produced by alcohol. Heavy consumption of alcohol can produce serious health problems and even death. If a pregnant woman consume alcohol, it can produce fetal alcohol syndrome, an irreversible condition associated with excessive consumption of alcohol, result with serious physical deformities and often mental deficiencies in newborn. We all know liver is the site which is most commonly affected by the misuse of drugs, as well as drugs can be hepatotoxic, and the reason why the liver is most susceptible is that most of the drugs are metabolized in our liver, and it is the cirrhosis of liver. Yeah, first it can produce fatty liver. We have studied the changes which alcohol produces in liver. Then it can progress to cirrhosis of liver. It's an irreversible condition characterized by replacement of healthy liver tissues with scars, which can lead to liver failure and death. And let's see how this alcohol affects our brain. And there are 3 different sites in which the alcohol affect. First, this alcohol affects the forebrain, assaults motor coordination and decision making. It first affects the decision making ability. Then alcohol affects the midbrain, those control over emotion. We have so many times we have come across in our life so many people. They become excited and they become emotional. And this is why, due to alcoholism, that is because it affects our midbrain. And finally, alcohol batters the brainstem as it affects heart rate, brainstem, and the heart rate is controlled by the different sites in brain stem, body temperature, appetite, consciousness, like all are controlled by our brainstem. And if it affects the brainstem, it is a potential dangerous, potentially a dangerous and fatal condition, and it can even cause death. Third type of addiction is morphine type, which are caused by opium. And we all know that opium is the latex obtained from the seed capsules of opium papaver somnifera. And in so small doses, it dulls senses, relieve pain, and induce sleep. The morphine is the most potent analgesic, and it is a wonderful medicine for the relief of pain. That is non-visceral pain. We use this morphine, but it is widely misused due to the hallucinations and euphoria produced, and it can be used for the pain due to myocardial infarction, cancer, sickle cell anemia, the severe pain, which conditions which causes severe pain. See the collection, we can see the collection of this latex of opium, and this latex is purified. This raw opium extract is purified to get we isolate morphine, codeine, and thebaine, and heroin is synthesized from this morphine by acetylation of this heroin. This morphine, you all know the structure of morphine. It is acetylated to produce this phenolic group in this morphine is acetylated to get heroin. It is these drug addicts consume or ingest it in several ways, subcutaneously, intravenously, or orally, in form of solution, tablet form. It is orally active also, and it acts extremely fast. Immediately after this injection, it produces this effect. If it is intravenously, it produces immediate effect in our body. And this heroin is an illegal opiate. We can see the acetylated form of morphine. And heroin was synthesized in the year 1874. So many years have passed, and it's still being used. Although heroin is illegal, it is still legally prescribed in some terminally ill patients like diamorphine. And causes dependence. Heroin causes although heroin causes dependence. When this drug is stopped abruptly, it produces severe withdrawal symptoms, anxiety, depression, cramps, vomiting, diarrhea, etc. And the addict can experience itchy blood, that is, there will be the pruritus and severe pruritus, and scratch the addict may scratch his body, and it can produce cuts in his body. Fourth type of addiction is barbiturate type. We all know barbiturates are sleep-inducing, anxiety, decreasing drugs, which comes in the category of sedative, hypnotic, and they are having so many medicinal use. It is used to treat epilepsy, to counteract the excitement and alertness obtained from the stimulating drugs such as cocaine and methamphetamine. It is used also. It is misused in suicide attempt. And there are so many different types. We all know the classification of barbiturates, and according to the duration of action, we classify barbiturates. The effect may start immediately, or it will be very short acting, ultra short acting, or it may last for some type of barbiturate, may last up to 2 days. Few minutes. Induction of anesthesia, if you use barbiturates, it can be injected into veins or muscles, but usually it is taken in pill form. There are so many street names given for barbiturates. Describe the desired effect. There are color codings for this. Drug vendors, they use several color codings also for this barbiturate. This phenobarbital, pentobarbital, secobarbital, phenobarbital, NIMBY's yellow jackets, which is nicknamed, or street name is like that. Then phenobarbital, purple hearts, goofballs. Not in, I think, suppose not in our countries, this type of name. They may name differently in different locality, that I'm not sure. And secobarbital, they are called reds, red birds, red devils, lilies. So many names are given by the addicts and vendors of this drug, illegal vendors, drug vendors. Next is amphetamine type, and amphetamine is the drug which is a stimulant, not like other category of drug, which usually depresses our CNS antihistamine producing CNS stimulant action and feeling of well-being. And you know what is a stimulant, feeling of well-being, and there's high energy. The students may expect high energy, and someone may consume this to increase their ability to learn. And the previous day of examination, they take this amphetamine and then start learning. And next morning they will become blank. And in the moment they feel that they are very much improved, they have improved intelligence, but next morning when they go for examination, they can be blank. And the medicinal use, or you all know, Parkinson's disease, attention deficit disorder, narcolepsy, and obesity, this drug is commonly used. Methamphetamine is an amphetamine derivative, that is the hydrogen in this amino group replaced by an ethyl group, that is methamphetamine. It is much more powerful, and it is called speed or ice by the abusers. They call it speed or ice, and usually come in form of white or yellow powder. And the method how they are sniffing through the nose, smoke, or inject it, it can be swallowed in form of tablets or capsules. Next is cannabis type. Cannabis is a flowering plant that includes two varieties, cannabis sativa and cannabis indica. And there are so many different names in different localities. In India, it is called bhang, hashish, ganja, charas, and all these are prepared from this cannabis by different processes. Bhang or hashish is prepared by cutting the leaf and flowering top of cannabis plant, dried and pressed or water purified. Pressed hashish, you can see the picture of the pressed hashish, and this water purified hashish. It is called bubblement. Usually it is called bubblement, which contains this water purified, usually contains much more higher concentration of active ingredient tetrahydrocannabinol. And ganja, what is ganja? It contains flowering top female plants are this most active. The flowers of female plants contain most high concentration of this tetrahydrocannabinol. And charas is another preparation. It is prepared by collecting the resinous secretion of these flowering plants. Just before flowering, the resin starter is collected, and as you see in the picture, it is available in forms of balls, or they are molded as sticks also. And another preparation which is available is marijuana. Marijuana is a dry, shredded green and brown mix of flower, stem, seeds, and leaves derived from cannabis sativa. They are rolled in form of cigarette and ingested by smoking. What are the effects that cannabis produced in our body? In the brain, it influences pleasure, memory, concentration, loss of concentration, uh, sense of time, sense of sensory perception. Colors can be smelled. That is, colors can be smelled. It is not seen, but we can actually smell colors. That's what the studies say. It lower BP, higher heart rate, risk for heart attack is 4 times higher, and smokers can experience respiratory problems, including daily cough. They may be coughing daily, increased phlegm production, more frequent acute chest illness, increased risk of lung infection can be caused by this type of addiction. And next type is cocaine type. Cocaine is not usually, it is a native of South America. Cocaine is obtained from the leaves of coca plant in South America. This coca plant is leaves of coca plant is usually chewed by the natives, like beetle chewing in our country. This leaves of coca plant is chewed, and cocaine in its purest form is a white, pearly product, and the dried leaves directly go through various manufacturing phases. This cocaine is actually isolated from this coca leaf, and its base, cocaine base is isolated, that is an alkaloid base of this alkaloid, and it is dissolved in ether, and hydrochloric acid is added to separate out cocaine hydrochloride crystal. It is water soluble, bases insoluble in water. Once the crystals have been collected by means of filtration, they are dried, resulting in powder form, which is as shown in the diagram. And what is the medicinal use of cocaine? Cocaine has been used as a local anesthetic for eye and nasal surgery, and crack is the strongest form of cocaine, produced by neutralizing cocaine hydrochloride with a solution of baking soda and water, and it is strongest form and gives very good effect, stimulant effect when taken by an addict. And they use this by 3 different routes: sniffing and also beta, nasal route, injection, and also by. What are the effects that cocaine produces? Dependence also. With excessive or prolonged use, the drug can cause itching, hallucination, elevation of blood pressure, as it is a CNS stimulant, so it can produce an increase in blood pressure. It can be life-threatening. So, breakdown of enamel and causes tooth decay. It can produce respiratory failure, irreversible damage to blood vessels in brain and heart, leading to stroke, heart attacks, and death. And how can, as teachers, how can we identify a drug addict? You can see how can we identify from physical appearance. We can identify alcohol can be detected when the student comes near us. We can detect the alcohol smell effect. We detect the smell of alcohol. We can suspect that he is an alcoholic. And extraordinary use of mints, mouthwash, etc. Because they do this to mask the smell of this alcohol. And their eyes are usually unusually bright. Glittering in eyes can be due to alcoholism, slurred speech, drawn out speech, rambling, and they may complain headache when they come to class. They may be complaining that they are having headache, nausea, hangover, and they may ask for leave. All these can be due to alcoholism, and we can say, ask the hostel mates whether the student is using alcohol, or can you find any hidden bottles in his hostel room, that we can ask and find out whether he is an alcoholic. And opiate abuse, that is much more serious than alcohol addiction, and it is very expensive also. They may have financial burden also due to, and they may they may do any means to get this drug. Very small plastic pills, bottles, or baggies may be used for storage, and we can find around the hostel room. We can see discarded syringes, spoons with burn marks. Spoons, they add this morphine or this diacetyl morphine, heroin, and sniff. It is burned and sniff. So burned spoon may indicate that they have drug use, and also if they use this bent spoon can indicate that they are using this drug, because the crushing with of these tablets with spoon can cause bending. And what are the physical appearance? You all know, pinpoint pupil, that is the most noticeable effect which is produced by this opiate addiction, because it produces meiosis. And that is how these doctors and these police officers identify. Prima facie identification can be done if they are having pinpoint talk of an mode of behavior in appropriate circumstances. They may be hyperactive, their nose may be red, and they may have needle marks in arms, behind knees, or ankles, and they always wear long sleeves to cover their arm. And they may be very sick one day, and they say that they are sick, so they didn't come to college. And next day, they may complain that they are, why when we inquire why you have not come to the class today, they may complain they are having cramps, stomach upset, diarrhea, and next morning he become very fine, and he may appear in class also. He may be very pale, sweating when the temperature is not hot, even sweating, profusely sweating. It may be due to this drug addiction. And they may borrow money. Students may borrow money even from teachers. They may borrow money from their classmates and or even from teachers. They may try to borrow money, and they may assign some reasons to pay hostel dues or to pay fees like that. They may say, and it is a drug which produces severe withdrawal symptoms, and they may have severe flu-like syndrome, they may have cramp, they may complain nausea, diarrhea, etc. And there will be change in behavior, sudden change of behavior, especially with adolescents. We all handle adolescent students. They may have new friends outside the campus, and they may develop friendship, and they start wearing new flashy clothes. Sudden decline in academic performance. Students who are very bright may show decline in performance. Lack of interest in known hobbies. They may be having some hobbies like reading or some drawing, and they may show lack of interest. Suddenly they start borrowing money, and they will be moody, and they may quarrel with other students, and sometimes they may be very happy and show you be unexplainably euphoric, and some new friends also we have to take into account. And this cocaine, it is opposite, just opposite. In eyes, this produces metrias. Glassy eyes is very large people. Nose that appears raw and red. Needle marks in arms, behind knees or ankle. Long sleeve, like all addicts, if they are having some needle marks, they wear long sleeve shirt in hot weather. Burns in mouth, burn marks in fingers. Fingers, if we notice their fingers, they may contain burn marks, and also teeth which are broken, and the loss of weight also. Sudden loss of weight is also due to cocaine, because it is a stimulant, and they may lose interest in taking food, and it can be a sign of this cocaine abuse. There will be changes in mannerism, and to sit still or stand still in our lab, or say when we are assigned to do him something in the lab, he may be relaxing, not doing the practicals properly. He may become, if we ask something, he may become nervous or aggressive and scratch, and tends to move very fast, picking a part of arms, legs, or face, picking behavior. Sometimes he may move fast, repeating the same action for hours, constantly sniffing, despite lack of cold or allergy, they may be sniffing, and restless, anxious, irritable. All this can be due to this uh, addiction due to cocaine, and they may also sweat profusely. Then comes marijuana abuse. Bloodshot red eyes can be due to this addiction by this cannabis. Expressionless affair. Blindly, they will stare at you blindly. Dry lips. Strong odor of burnt rock or grass on a person or clothes. Yeah, it may be due to the smoking of this cannabis, and mannerism. There will be changes in mannerism or behavior. Walking around in euphoric stupor, lack of emotion, staring out into space or at nothing, blank staring, laugh where there is nothing to. You may suddenly start laughing when there is nothing to laugh. And as teachers, we have responsibility in our students, but now we are not seeing our students. They are at home. They are, due to this COVID pandemic, we are not coming across students, but this I'm very positive that this situation will improve, and we can start our classes regularly as usual. Then everything will be normal. And if we suspect, when the situation improves, when the students are close to us, then we can if you suspect a drug abuse in a student, you should take following action. Collect evidence of abuse without prejudice. You ask your their classmates, you can ask even their parents whether they are having any problem. And if you are suspecting, you can seek the advice and help of addiction professionals. There are so many centers available in across India where we can approach. We can find it from by googling. We can find the centers and we can suggest our students and recommend them to approach them and communicate your concern to your parents, and you also discuss the same with other teachers also, whether they are also facing the same problem as we face or as we identify, and we can help the student to recover from this situation and follow through whatever recovery help you can provide. You can provide him, you can bring him back to the mainstream, and you can help him to complete the course. And these are my references. Thank you very much for listening to me. Thank you very much.
Thank you, ma'am. Thank you for the wonderful session. And there is a comment from Dr. Thiru Chitrambalam that the topic is relevant for students. Faculty members and parents should also refer to this.
Thank you so
and it
much,
was-
sir, for your nice words.
Anyone else? Any other participant wish to ask anything to ma'am?
Ma'am, may I ask one question from you?
Yes, yes.
Ma'am,
Please.
mostly jaundice occurs at the last
Yeah.
in overconsumption of alcohol, and it may lead to mortality.
Yeah.
Can you enlighten on this?
This alcohol usually causes liver damage because mostly this alcohol is metabolized. First, it produces fatty liver, then it progresses. So slowly, it progresses to cirrhosis liver. So, liver damage is usually presented as, sometimes it may be presented as, usually due to the obstruction of bile, it may be presented as jaundice. And so many liver problems are usually presented as jaundice. And if we treat the alcohol, so if we abruptly stop and treat, and you know that liver is an organ which is having tremendous capacity to regenerate. It regenerates if we stop alcoholism, or if we stop any noxious stimulant which is affecting the liver, we can recover and regenerate. The liver can be regenerated if timely help is given. We can prevent this. Even jaundice can be treated and cured. And so many, we have also come across so many herbal remedies. Our researchers, our teachers are researching on these herbal remedies, which are very much effective which are having hepatoprotective effect. Hello?
Yes, ma'am.
Can you
Anyone
hear me?
else? Yes, ma'am. We can hear you. Anyone else? Any other questions? So, Yokita Goyal ma'am has said as, thank you, ma'am. Okay. Any other comments or any
Thank you
questions?
very much, Geeta Goyal madam, for attending this program.
Hello. Thank you so much, ma'am. This topic was a bit new for us, which we have not frequently heard in.
Madam, you are not audible, madam.
Yes, sir. There is a actually poor connection of network. Am I audible
Yes.
now?
Yes, ma'am.
Tell me, madam, please.
First of all, thank you very much for your good information, ma'am. Hello.
Thank you, madam. Thank you so much. I can hear you.
Any drugs for the recovery of the suspect of drug abuse in student, ma'am?
There are so many. We have to treat this drug addiction according to the type of addiction. Yeah, there is no general drugs for treatment. There are treatment schedule in re-addiction centers with methadone maintenance. If they are alcoholic, we can give them methadone and they are maintained with methadone. And slowly by tapering, we can stop this addiction. There are treatment schedule available. We can't abruptly stop the drug because they may they may show severe withdrawal symptoms. So there are so many treatment regimens available according to the drug which they use. We can do, and for this. There are certain type of addiction that is usually cannabis type. If we stop, it is only a psychological addiction that will not produce any problem. Only by counseling and by rehabilitation and counseling, we can actually reverse the condition.
So in case of alcohol
Thank you,
addiction,
madam. Thank you so much for keenly watching this program.
okay.
Hello. Madam, one Dr. Seema Venkatrao, madam has started talking and suddenly she got muted. Madam, you want to ask something?
Madam?
No, sir, I have asked already.
Okay, madam. Thank you so much.
Okay, so I think it's there are no queries more. So first of all, I extend my sincere thanks to Rajasree madam for accepting our invitation to participate in this FDP. Thank you very much, ma'am. Thank you for your wonderful lecture. It was really an insightful thing. On behalf of
Thank you.
On behalf of National College of Pharmacy and ADAL FDP, sincere thanks, ma'am. Thank you.
Thank you. It was a wonderful experience sharing my thoughts and the subtopic with other teachers all across India. And thank you so much for, once again, I thank everybody for attending this wonderful program, as well as you are attending a series of programs, and all the best for your future and also your academic career. Thank you so much. Thank you. Thank you, sir.
Participants, please note that next session is by Dr. M.K. Unnikrishnan, personal effectiveness through digital communication, online methods. Session will start at 1:30 p.m. in afternoon. So till then, bye-bye. Thank you, ma'am.